Hello students, in today's class we will discuss in-service training. This topic is very important for especially health center management subject, and sometime it may come in uh, uh, administration and supervision subjects also. So what is in-service training? An in-service training program is a professional training or staff development effort where professionals are trained and discuss their work with others in their group. It is a key component of continuing medical education for physicians, nurses, pharmacists, and other medical professionals. It is also known as on the job training. So, sometime in your exam, you may find a question on the job training. So both are same. It may be in service training or it may be on the job training. In service training for nurses. In service nursing education is a planned education activity intended to build up on the educational and experimental basis of the professional nurses for enhancement of practice, education, administration and research through protocol development aimed at improving the health of the public. Importance of in-service training for nurses. On-the-job training is very important for all types of workers, especially for nurses. It is a key for better nursing care. Health system is a complex system and concepts changed and updated very frequently. Therefore, nurses need to change and update their skills and knowledge in order to provide better health services. In the era of increasing lawsuits against healthcare professionals, every change in medical procedure, surgery for and diagnostic activity need to be updated. These updated knowledge and skill lead to better and perfect nursing care to the client. In-service training for nurses play an indispensable role in improving the quality of inpatient care. It means in-service education is important for both healthcare provider and healthcare receiver. Objectives of in-service education. Why we should go for in-service education? It is very important. In-service education help to improve professional competence. It keeps the nursing personnel updated with the latest trends and development of new technologies. It helps nurses to update the knowledge and skill at all levels of development. It helps to develop interest and job satisfaction among the nursing personnel. It encourages employees in achieving self-development and self-confidence. It develops leadership skill and motivation among nursing personnel. It improves quality of nursing care and thus beneficial for clients also. It improves boredom of same routine and staff feels refreshed. Now types of in-service education. The types of in-service education can be based on time, based on objective or based on method. Based on time, it may be short term or long term. Short term trainings may be for 1 day or even few hours also. 2 day, 3 day or even up to 15 days. And long term training may start from 15 days to months, years, such as master's training program in nursing. Based on objective. Based on objective, in-service training for nurses may be orientation training in the hospital, skill training, higher education training, leadership and management training. Then based on method. Based on method, the training may be lecture, demonstration, symposium, workshop or e-learning. Now we come to lecture. What is lecture? Lecture word is taken from French word meaning reading. It is an oral intended to present information to teach people about a particular subject, for example, by a teacher in the class. Lectures are used to convey critical information, history, background, theories, and educations. A politician's speech or even a businessman's sale presentation are similar in the form of lecture. Usually the lecturer will stand in front of the audience in a room like in the class and recite the information relevant to the lecture's topic. Some advantages of lecture include quick exposure to the new material, greater teacher control in the classroom. It is an engaging format which may complement and clarify course material and facilitate large class communication. Lecturing also permits the dissemination of unpublished or not readily available material. The lecture method can be made more effective when it is used with audiovisual aids or with discussion. The disadvantage of lecture include placing the student in passive and encouraging one-way communication. Second method is demonstration. Demonstration method normally used in skill type of training when we want to improve the skill. Demonstration is a process of teaching someone how to make or do something in step-by-step process. In demonstration, you show how and you tell what you are doing. This method is used for skill training and is very effective. Demonstrations are used frequently in clinical setting, often without advanced preparation, like bedside teaching. Obviously, the more familiar the demonstrator is with the equipments and nursing procedure being taught, the better the demonstration will be. Demonstration has many advantages of using visual as well as oral perceptions, thus facilitate learning. Other senses may also be used, such as smell and touch. Although some nursing procedures can be taught by simulation in the labs, but they are best taught with a patient. For example, when we are giving tracheostomy care or irrigation or colostomy, these are best taught in the at patient setting or hospital setting. Next type is symposium. Symposium is a discussion method like group discussion in which different viewpoints on a single aspect of topic is discussed. Symposium is series of speeches on single aspect of the topic. Symposium provide broad understanding of a particular topic. Symposium technique has a series of speeches where two or more speakers talk about 10 to 15 or 20 minutes and develop individual approach or solution to present the aspect of a policy, process or program. At the end, the audience may ask questions and chairman makes a summary of the symposium. Then workshop. Workshop method is also very beneficial method. Workshop method help the instructor to create an environment in which learner is more likely to be involved and motivated. The workshop method focus on participatory, hands-on practice and skill learning. A workshop is informative or instructional class focused on teaching specialized skills or exploring a particular subject. Workshop presenters are usually educators, teachers, subject matter experts or managers or other leaders who possess knowledge of a particular subject or mastery of the specific skill. Depending upon the topic, workshop may be only 1-2 hours or it may extend across the weeks of time. Now e-learning. This is the latest method and it is also very effective and it can be applied to a large population in short time. E-learning is a learning by utilizing electronic technology to access educational curriculum outside of a traditional classroom. In most cases, it refers to a course or program or degree delivered after completing it online. After completion the training, a certificate is also issued online. It is a very effective way of delivering the course. Due to its convenience and flexibility, the resources are available from anywhere and at any time. Anyone who are part-time student or working full-time can take advantage of web-based training. As a nursing professional, you can learn from Indian Nursing Council's website. This is their web address www.indiannursingcouncil.org, and igot website, that is igot.gov.in. And these days the trainings related to corona or COVID-19, they are hosted here, and open WHO website and any other website you can search online. Thank you, students. You can visit my blog for making your notes, that is mynursingstudents.blogspot.com, and you can follow on Twitter also, so that you can get update regularly. Twitter handle is @student